Hello. Hi, Lily Chen. We are live. How are you?
I'm good. Thank you so much for inviting me. I'm excited to chat with you. And I guess the only one bio I want to add is I am a mother of five wonderful adult children and
Woo!
my first granddaughter, Sophia.
Wow.
So,
Wow. You look so young and you're young grandma. Wow. Awesome.
young at
Awesome.
heart.
Yeah, young and her. So, yeah, I always like to ask people where they from. Tell us a little bit of your upbringing, please.
Yeah, absolutely. You know what? I'm very excited. Actually, I thought about this. I said, I want my children to know where I'm coming from, who I was before. So, very briefly, and I came from Canton, China. Canton is a city in southern part of China, right next to Hong Kong. So, I do speak Mandarin and Cantonese.
I know how
Uh,
to speak Cantonese. 唔識講
大家好，我好高興嚟到呢度。大家好，很高興來到這邊。
beautiful.
Yeah. Cantonese food, I'm sure, dim sum and all that. So I love that. So I came to the United States in 1988 as a graduate nursing student, and 1988. So I got my master's degree in nursing administration. So Iowa City, I just love it. I had a most wonderful, beautiful, what I my colleagues and professors, and I ended up teaching there for 4 years in University of Iowa. And I think that what I love about nursing, I wanted to, share a little bit is because I feel like nursing is such a profession that you can go to so many different fields. You can be a clinician on the bedside, taking care of people. You can be education, like I'm doing right now. You can be a research. You can be a policymaker, and you can also be a community organizer, like I am right now. I think all those experiences kind of prep me, and I think most importantly is really kind of foster my empathy and also the heart to serve other people from the wonderful education. So
Yeah.
anyway, so I moved to Chicago 1997, and I started teaching at University of Illinois in Chicago. And after a semester, I said no more. The traffic was horrible.
It's
Driving,
cold.
and yeah,
Cold.
horrible. Yeah. So I then started teaching at a Catholic university in the suburb, and then I started raising my kids, stay home, and for about 5 years. And after my child number, I can't remember. Yeah, I know. Okay, so after my child number four was born, and that's what happens to you when you have so many kids. I swear, I said every kid it kills like 20% of my brain cells. So 5 years later, I remember nothing. But anyway, so I stay home and for 5 or 6 years, and I started to do elder care. So I started a called the Xiling Adult Daycare Center in Naperville. So I helped started that as the nurse, the social worker, the dietitian, the activity therapist. And so that's when I started to get involved with the older adult care. And then also I work in school because I said, oh, I got so many kids in school. I mean, what just work here.
Mm,
So I get to see my kids, and I used to volunteer. So I work at school as well.
mm.
And then I and my family, my husband got a new job, like in 2018. So then we moved to Cary, North Carolina,
Mm.
and
Was it a big stretch, a big change for you, climate wise?
uh, it's for the better
Oh,
because I couldn't stand the snow anymore in Chicago. I said, please,
yeah,
I
yeah,
used to be able to run outside like 20-degree below, like
yeah.
early in the morning. My neighbors, that is so crazy. I said, I love it. But as you get older, it's like I don't like those cold weather anymore at
Mm,
Chicago. So I love it here. I just went swimming this morning. I always go outside to walk. There's a lot of greenways, and
mm,
so I love in the carry more nature-oriented trees and
mm,
all that. But it was difficult to move. I
mm,
would say I miss my friends in Chicago for sure. Yeah,
mm. Yeah, Chicago is a beautiful city. Yeah,
yeah,
it's
it is. It is. Yeah,
cold
yeah.
and traffic. Yeah. So,
Um,
now tell us a little bit. How did you get involved with UCA?
yeah. So part of the things one of the things I miss about Chicago is really missing my friends that were very involved. That's when I started getting involved with the Chinese American community. Is when I started to help my friend Teresa Ma run the state representative race. At that time, there was none AAPI state representative, and she's from District 2, which is around Chinatown area.
Mm.
So we live in the suburb. I said, gee, this is great. We need to have a representation. We need to have our voice. And she's my good friend. I got to help her. I don't care what kind of position she runs, it's for a good cause. And we just need to help her. So a lot of our friends that came together, was really exciting. I think it's 2015. We had the first fundraising for her. And then we would go crazy, going to Chinatown, knock on doors, doing fundraising and organizing ourselves. I remember my friend Jim Ma and I were like going to the grocery store in Chinatown, just literally grabbing people, register to vote, go vote. So people were teasing, you ladies just grabbing people from the street. I said, yeah, that's what we do. So anyway, so it was really exciting to see our community come together, because Chinatown has historically only have 500 votes. People come up to vote. On that race alone, we increased by like 2,000 or 2,500. I couldn't remember. And Teresa won by 500 votes. So she had a little bit over 10,000. Her opponent, who is the son of the sitting representative, who wanted to just pass the seat to his son, and so he lost. So that was very significant. But after the race, I said, I'm done. It was a lot of work. It was fun. But you just can never control your own like destiny or life. But, next thing I knew is that I met Hypatia, who was involved with the race, helping Teresa, who is the founding president of the United Chinese Americans. And then I was, they are organizing the first Chinese American Convention 2016. I said, that's great, because the UCA's mission is civic engagement, political participation, and youth development. And so I just thought that it was really a good platform for Chinese Americans to come together and continue to advocate for ourselves. And so that's how the rest is history. So 2015, 2016, I started, serving at the steering committee of the first convention, 2016 in DC, and then 2018, the second convention. And then now, as next week, as we're speaking, it's going to be the third Chinese or UCA convention and the first youth convention.
Yeah. Look, I put the United Chinese Americans website here. Can you see it? Can you see it?
Website?
Can you see it right now? I put it here right now.
Did you see okay. You mean on the things that on the bottom?
Wait, hold on 1 second.
Yeah. Oh, on the comment, right?
No. Like now.
Great. Yeah, I saw it. Thank you so much.
Yeah. So
thank you.
That's your website. That's United Chinese Americans website. I shouldn't say yours, because I am too, because I just joined.
Yes, welcome. You see a new member. Congratulations. Yeah. I'm so excited, Juhl. Thank you. Yeah.
So it's this
is the same family.
Yeah, United Chinese American is a nationwide nonprofit and nonpartisan federation and civic movement inspired and dedicated to enriching and empowering Chinese American communities through civic engagement, political participation, heritage sharing, youth development, and a greater understanding between the people of the United States and China for the well being of all Americans and this world. Who wrote this beautifully?
Oh, thank you. Yeah. It was, I remember like it was a really a collective effort, but I have to accredit to the vision of our president, Taipei, and he's very visionary, and he literally he traveled around the country for 2 years, state by state, gather around the beautiful Chinese Americans and have them, share the vision. And also I would say that I think one of the things about UCA I will always tell people is the people that I have met is absolutely the most beautiful and dedicated Chinese American, including you, Juhl. So anyway, I think it's amazing. I have got to know a lot of great friends. So like convention is also a time for all the friends come together. It's like, okay, you come to 2016, we share the pictures in 2018. And, other than that, I think it's also, I wanted to kind of pivot a little bit. that is a great platform because it's youth development is one of our mission, right? So we have using this platform at getting incredible support to start to advocate for mental health in particularly in our youth, because AAPI community, the suicide rate, it is really high. Actually, it's the leading cause of death according to CDC.
Mm.
The age of 14 to 24, and the college kids have the highest also suicide attempt. So, but I need to, just don't call me. My memory is not very good these days. Okay, so for CDC, I have to have full transparency and disclosure. Anyway, the stories we heard, the friends that I have, and the children, suffering, and the most heart breaking, it was that they suffer in silence, and they die in silence as well. I have heard so many death by the youth, and their parents have no idea. It's like, how could they possible, these most outgoing, successful, and these children, right? They just it was heartbroken, but so I just felt like this platform is very, very relevant to combining my background as a nurse, and then public health nurse, and also my activism together to not only provide educational opportunities as well as advocate for our community, to advocate breaking the silence and encourage people to talk about it, and empower our community to collectively find a solution to decrease youth suicide.
Right. So tell us a little bit about the highlight of this third convention. I know the conference will talk about mental health. You're gonna have also keynote person to talk about that, right? Is that you or another?
Yeah. Oh no, I always don't think of myself as an expert, but I am a public health nurse and I'm an organizer. But again, I'm not a licensed psychologist or psychiatrist, but it takes a village. It needs everybody on the table, right? We need to have a licensed professionals. We need nurses. We need to have community organizers. We need to have researchers so that we can substantiate what we do, provide data, right? And then also we need to have the policy makers and policy changes so that we can have more resources allocated for AAPI community. So obviously mental health, it is a highlight. We have a 7 sections plan. We have in just at this moment, we have been Director Chang Chang is making a short documentary. It's called The Silent War. So he has been traveling around the country. He has been in San Francisco. Just I was with him last month actually, and he just went to New York City yesterday to film Congressman Grace Meng. And then we have we have been interviewing. He has been interviewing members of our community, from youth to parents to elderly who suffer mental illness. And also in such a tragic moment, so we also see hope that people really wanted to talk about it and wanted to let people know about their struggles. And also, even though it was extremely difficult, we just have a webinar last week, actually, and I was in tears. And it was just really difficult because it's really triggering to a lot of people talking about this suffering. But even though it was difficult, I also see tremendous courage, from our community members, broke the silence and very bravely, courageously talk about it. So that's the first section. It's on Friday night. It's a Friday night, July 15. And then right after that, we have a SAMHSA is a Service Administration for Substance Abuse and Mental Health Services. SAMHSA, who are giving us actually they offer that to us. It was really grateful. They say, why not we do a special session for you so we can talk about the government fundings and resources and how that works, in the community. So they're going to have a special section talk about the federal government resources, because if you know, SAMHSA is the leading agency under the Department of Health and Human Services, responsible for funding and and policy in terms of mental illness, right? So we're going to have a second section, and then on Saturday morning, we're going to have a Robert Johnson Foundation Clinical Scholar team. I'm part of the team. We talk about parent and child communication. So my colleagues and team members, Justin Chen, Juliana Chen, and Wei Yang, Xie Wei Yang, and we're going to, and also the parent and youth ambassadors, we're going to talk about how to effectively communicate with the parent and child, because we felt that that's really the first line of prevention or primary prevention, is that how to listen with empathy, not too judgmental, not just focus on grades, getting A's. Why didn't you get A plus? Because the expectation is so high. But and then we'll also have a following. We're going to have an advocacy section, and Daphne Kwong from Vice President of AARP, who's going to be on the panel, and we have two great community organizers in Chicago and San Francisco, Yiling Peng and Hong Liu, and plus Dr. Bei Wu from NYU, who is doing a research on the API, on the elderly dementia, and also the effects of the mental health. And we have a demystify medication. So we have 3 psychiatrists led by Dr. San Shi, who is our WAVE, is a youth mental health program as consultant, and have a Jessica and Jane and Sarisa Chan. And last but not least, we have our wonderful youth ambassadors, and they come up with this topic. I say, hey, this is the platform for you as well. I said, what kind of topic would you like to talk about? We have Jennifer Tu, who is the WAVE previous coordinator, succeeded by Jessie Lee, and also with the other panelists on the panel, they talk about LGBTQ community and what it's like, what's coming out looks like, and how it feels like, and how the parents can support them. So, and then I should say that we also have a community showcase. We have about 11 organizations from across the nation going to showcase the great work they're doing from Chicago, San Francisco, Boston, and also Maryland. And we have book authors. We have University of Maryland Center for Anti-Bullying and PPI, and we have a Center for Cross-Cultural Emotional Student Wellbeing from Massachusetts General Hospital. And this is just name a few. And then obviously community organizers and National Alliance for Mental Illness, NAMI Chinese. So we are really, really excited. It was, to get this opportunity to showcase what we do. I am also, I wanted to say that I'm the, obviously that's my background focus on mental health, but I also help organize the convention other component. We have Congressman Ted Lieu and Judy Chu and Grace Meng as our keynote speaker. And we are going to have 5 plenary sections: U.S.-China relations and civil rights and grassroots organizations. And we have multiple panel breakout sections. We focus on very, very community-based and grassroots organizing. For example, how to do fundraising, how to apply for the government grant, or K-12 education and AAPI history and museum. So this is something that really affecting our community, and we really want to. And we just like yesterday, as if it's not busy enough, we had a community roundtable discussion. So we have about 12 of those self-organized roundtable. But I will be not doing a convention a favor. We're going to start the convention with a congressional visit, but this year due to COVID, so most of the visits are going to be virtual, and then we're going to have a reception. And then we're going to feature your film, Juhl, Yang Gang Diary. So this is it. I know we're so excited because it is a community platform, and we wanted to showcase our wonderful Chinese American artists and filmmakers, and also just great work. I wish we had more days and more sections to accommodate everybody, especially, we came together in such a short time, but we'll really try to do the best we can, and I can't wait to watch your film.
Well, thank you. And now I'm wondering if how do you incorporate with the youth convention? That's your first time.
Yes. Thank you for asking that. So what I have highlighted, I'm sure that missed a lot of wonderful things, and so you have to pardon me. Remember, my memory is not as good as it used to be, but anyway, please go to our website, right? You show our website and go to see the entire agenda, and also there's ways for you to get involved and for you to donate. Obviously, it is entirely primary volunteer effort. And the youth convention we call the first national youth convention. So we have about 200 youth registered already, and we have 300 adult registered already. So we are, because one of the mission is really focused on the youth. So we have sections like we had keynote speakers from a rapper to a New York Assembly woman. I am so Neon is NIOU. I'm so embarrassed I can't pronounce her name. And we have, yeah, I know we have a Christine Chen from API Vote, who's the executive director, and we have also the organizers from Dear Asian Youth. The founding executive was Chinese American, and we're going to talk about a variety. Again, I have to admit that I'm not involved with the youth convention, so I'm sure that I'm not doing their great service, like mentioning, like talking too much about it, other than just overall of the youth convention. And so the youth convention Saturday, they have their and there's an API organization showcase. There's about 26, I believe, like organizations showcase their great work. So we're very excited about their work. And so Thursday and Friday is the same as our regular convention. Saturday is their own convention. So again, the committees, volunteers have been working really, really hard at this moment. And
That's wonderful. That's so awesome. Yeah, I wish I get involved with your organization earlier.
You are involved now, so that's all it matters. Anytime is a perfect time. Thank you so much. And then you bring your wonderful son, who is just graduated from Juilliard and joined the Pittsburgh Symphony Orchestra. We would love to hear him play at the reception or something, because I have 3 kids. Actually, all 5 of them took music lessons, but
nice.
Not very many stayed. But anyway, 5 of them took lessons.
Yeah. So what is your advice for people, because you're a mother with 5 and you do so many things, you're not just stay home. How do you balance, your family life and being a mother? Like, how do you make sure your 5 kids all, have a so-called good, family life and also do well? Do you have any any advice for mothers or other people?
First of all, thank you so much for asking that question. And I will always think that my biggest blessing in my life is my family, my kids, and my husband, right? And secondly, I have to admit, it's not easy at all to balance. So I have to admit that. I think it's very common among mothers or women, and we always feel like, oh gosh, I should have done better. We could have done better. And oh gosh, I couldn't remember. For example, I would say one of the regrets that I have is because before, you think that, oh, I work at school, I'm a nurse, I should know about mental health, right? But I didn't. I didn't until I got involved in 2016, 2017. A couple of my children struggle with mental illness and like anxiety since grade school. I had no idea. So if I knew then, my children could have been much better supported. Like, for example, one of my child hated to go to recital, because, she's playing instrument, hated to go to recital. I have 2 cellos and 5 pianos, when they're growing up. So we have 2 pianos, a cello, and guitar and all that in my house, right? I don't play, so I don't play. But anyway, so she hated to go to recital, and then we always says, you're so sociable. What's wrong with you? It's so fun. You always have so many friends. Blah blah blah. Not until just the past 2 years, I realized, oh my gosh, this poor child of me has performance anxiety. That's nothing to do with her personality, with her being difficult. Sometimes it was so easy to judge, right? Difficult, or my other child is like, the other child just quit everything, right? He's not interested in everything. He was so, the child was so social, have a lot of friends and involved with everything, just withdrew from one activity after another. I just remember, I just kept saying, why don't you do this? Why don't you do that? But I didn't realize the child had depression in
Mm.
high school.
Yeah.
Very, very tough years, right? So in that regard, I always think that that's one of the passions that I wanted to, share my experience with the parents.
Mhm.
Like these are the very signs, it's very easily to overlook. And because I was a nurse, when I came as a nurse, I mean, graduate students, I have to retake psychiatric nursing and community health nursing because we learn nothing about mental health and
Mhm.
community health nursing in China. I got
Mhm.
my bachelor's degree in China, nothing.
Mhm.
So you can tell the mental health knowledge is very, very poor
Mhm.
in China, right? So it's about 50 years of difference. So anyway, so that's some of the things that always stays with me. Oh gosh, I wish I knew better, could help my
Mhm.
children better. That's just two examples. So,
Mhm. Yeah.
but at the same time, I always also know that, we have to live at the moment, right? We can't just beat ourselves up.
Mhm.
We're always going to be something that we don't do well. It's always going to be the grass is greener on the other side when you compare. Oh gosh, I don't know how to do that. So don't compare with me. I'm not going to compare with others, or I'm not going to compare with you. You're such an accomplished musician. So each person has a different circumstance in life and personality and family situation, right? So, but I would say, take each day as it is and count our blessings. And I think that I always tell the parent too. I know that all of us, of course, I love our children. We want the best for them. We did the best we could at the time,
Mhm.
and we're still trying to do the best we could.
Mhm.
So I will say, that's what I would tell the parents. Don't, and then also self care, because as we know more, a lot of things actually we project our past experience, we project our childhood, or our parents' childhood, is intergeneration trauma, intergeneration, um, you know, uh, issues, right? Pass them
Mhm.
down. I saw my pattern of communication. I saw them in my mom. I saw them in my grandparents, but I never thought about this kind of things, right? So aware of your own feelings and
Mhm.
emotions and your stress level and what kind of bothers you, we need to really take care of ourselves first and be aware of who we are and what kind of triggers us, what
Mhm.
our passions and stuff, and then so that we can be a better parents.
Mhm.
And that's one thing I would say. I'm sorry, I keep rolling around. And then secondly, I would think that and yeah, I said a few things. I'm sorry, like don't compare yourself and appreciate the moment and appreciate each child. And then another thing, I have so many things, but I guess I will say is that at the end of the day, what it matters most is your relationship with your family, with the children, and not how much they accomplish or if they listen to you or not. If this is the right husband or right boyfriend, if this is the right, choice for your partners, or if it is the right career they chose or whatever. Just remember that sometimes I'm making that decision sometimes on a daily basis because one of my children, is like that. Do I want to have a relationship with my child, or do I want what I want that I think is best for them? You know what I mean?
Mhm.
So that comes down. So I think that would be another this, yeah, that's another advice. I can keep on talking, but this
How
is
do you
really
how do you take care of yourself? Like, do you have a routine exercise you do for yourself?
yeah, I do. Like this morning, I went swimming. I love walk
Yay!
and biking and jogging. Not jogging, like very very slow, like walking. Let's say walk. I
Mm.
don't I don't run too much anymore. I do love it. I think part of it is because I just can't sit still because it would drive me crazy. But biologically, endorphins are released that make you happy when you exercise. So I cannot emphasize that enough. That you really have to make time. Like yesterday, because the convention it was crazy. 15 hours I stayed in this spot. Like just went down to go to the bathroom, grab something to eat. I haven't eaten pizza for like months, years. Not that I didn't like it, but
Yeah,
I just didn't have time, right?
right.
So, but I think it's really difficult. Sometimes the family is really busy, but it's really you got to prioritize yourself, take care of yourself first. So that part I normally do well, and that's why I don't want to keep too busy and then you forget about taking care of yourself. So that balance is really difficult, but I try.
Right, right. Wow, that's wonderful. So you tell us a little bit. You teach in different capacities. Um, so currently, what do you do in terms of teaching or yeah, nursing related education?
Yeah, yeah. So I'm a full-time faculty member at North Central Carolina University, NCCU. I teach community health, which I love. I love because I can bring all my experience, all my students, to the experience that I experienced. For example, the mental health first aid training, and also the education webinars, and taking students to the field trips, and also my other experience and advocacy and stuff like that. So um, in the spring, in the fall, in the summer, I know that it's really busy. So I usually like to take the summer quote unquote off, but not really off. Is so
Mm.
that I can do like things like I can help plan the convention, and I can went to visit my granddaughter. I just spent 3 weeks in San Francisco while working remotely, or I went to New York City to visit my other daughter. So I will be able to, do those kind of things. But that's my usual. And then my other responsibility is, I mentioned before that I'm a Robert Johns Foundation clinical scholars. Actually, I serve as a project director. So we are, and then also I'm the project director for UCA Wave. It's a wellness, advocacy, education, voices, and support. Is a youth mental health collaborative. So it is a lot of work. Almost, but it's a lot of work. So I try to kind of, do those. And besides that, you know, um, I don't know what else, just, and I try to balance that, but it is really difficult. So you
So
just don't
this
have enough, yeah, you don't have enough
after
time. But that's kind of my like a job, or
the,
like
uh-huh.
a pay job, I should say.
Yeah, well, that's nice. You're full of energy, and I think UCA and is very lucky to have you. I can see all the you get stuff done, and I always admire nurse because I think they're caretaker, they're health worker, and they have to do so many tasks at the same time and do it well. They have to have the heart to do the thing, not just the doing things, right? They're not just the make sure the patient is clean. I mean, they really, like, I had several procedures in the United States, and I just really um, I love my nurses, and they're so wonderful. So
Yeah.
I think it's a profession involves
Yeah. You know what?
so many
Yeah.
parts, right?
Yeah.
Go ahead.
Yeah, I thank you so much for mentioning that. This is my profession, obviously, but I have to say, nurses right now, it is really heartbroken because of pandemic and because of
Mm,
COVID, they have been um, at the mental health is a crisis among all. It's a crisis in our nation right now, right?
mm,
But I would have to say, frontline workers and nurses are really at the breaking point, because we are so giving, sacrifice everything, our own health, that's why I say self-care,
mm,
right? Our
mm,
own health, our own family. And you heard the stories on the news about how many nurses stay, and the doctors too. One of my daughter is also a resident, and they just like taking extra shifts. But what is heartbroken is they don't have the enough support
mm,
institutionally and also
mm,
on the policy wise.
mm,
So um, I think, like, I have a mentor, or I have precept a graduate student, last semester, and she is getting her master's degree, and she also actively in the nurse. And or just hear the stories. Though I don't practice nursing in a hospital, but I do have students,
mm,
and I do have students. I do have friends who practice in nursing. Like, for example, one of my friends, a Chinese American nurses working in the ICU, right? So there are about 20 plus nurse. I wanted to say like a 20 plus, like 29.
mm.
At the end of COVID, there's only 6 nurses left, and then she was one of them. And all the other nurses now is what we call the agency nurse, right? So because they are just so hard, yeah, it was so hard at the in the hospital. And one other nurse that I didn't know get bullied and actually get yelled at, go back to China while she was practicing nursing in the waiting room.
Mm,
And but again, our friends didn't want to come out because there's a hospital. I'm not going to mention names. I'm going to mention hospital, but they're getting bullied and they're getting abuse, verbal abuse, or even physical abuse of healthcare workers. This is a really real. Can you imagine?
Mm,
You're saving people's lives, and you put your life in the front, especially during COVID, right? So
mm,
many nurses and doctors pass away too from the
mm,
COVID. And then you're enjoying the not enough support, and then you're enjoying also the abuse. And I'm sure that there's a lot of people like you, June, really, really appreciative of the nurses. And
mm,
I'm not like saying, the profession is not being appreciated. I'm only saying that the nurses are at a very, 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 very vulnerable and special moment because of the double pandemic
mhm,
of the COVID and mental illness and mental health.
mm,
And also for the AAPI community, so I will have to say anti-Asian hate and the hate crimes against AAPI, and nurses are not the exception. I think that was one of the reasons. Actually, I wrote a letter to the editor to the local newspaper about racism in nurses, and also I have written like 4 op-eds published at Atlanta Journal-Constitution about racism, about mental health, and about AAPI community, advocating for the AAPI community.
mm. So historically, I understand professional nurse is a very needed job, needed, like it's so-called easy to get employed. Is that true now or not?
Yeah, I will have to say turnover is extremely high. I even in the like where I live around RTP, we have the world class hospital Duke, UNC Chapel Hill. We have like Wake Met. We have like a lot of hospitals, and I think they're experiencing a nursing shortage. And I know that because they have to really didn't have enough time to orient the nurse, because of the shortage. So our students graduated like expected to be functionally fully like a professional nurse. Supposedly, normally they will have at least 6 months to a year of like a training or orientation, but they might be. I'm not saying every hospital is the same, but they were put into the position that they might not feel comfortable enough to provide the care in some places, in some instances. I think this is just you can understand why, right? Just because the demand is so high. Um, I would think that nursing is such a noble profession. I think that it's very challenging. I think it's. I hope at least that still there are other people who want to become a nurse. It is nursing has been rated. I think it's 17 years in a row. It's the most trusted profession in the nation. 17 years, I think. Yeah, I have to say above the lawyers, above other professions. Not that we don't have respect for them, but that speaks very loudly about public trust about this profession. I'm very, very proud of to be a member of the nursing profession. And I wanted to add something too. It's so funny because I usually don't use too much about my nursing background in my civic work,
Mhm.
other than some values. But I think that even during the convention planning, it came to the discussion about the COVID precaution. So I was able to using the public health training and nursing training, work with everybody, with the physicians, with the health, with you know, uh, the virologists. So we happen to have biologists in our team, and uh, uh, with other members of the team, we will develop a COVID policy. And so I'm happy that I was able to, not practicing nursing per se, but the background really kind of helps me to kind of set the framework and also set the boundaries. And I can have that kind of ability to see, hey, what is appropriate, what is not appropriate, even though I'm not the expert, like
Mhm,
in terms of COVID,
mhm.
mhm.
Yeah. So was it difficult for your whole family to deal with COVID in terms of COVID? Like it's been so long, 2 years. Did you guys like
Yeah.
have to be very careful not to go out, or did you get
Yeah.
COVID? And if you get COVID, what do you do with it?
Yeah. Yeah.
You don't have to tell me if you
Oh, no,
don't.
no, no, no. Actually, this is such an important topic again. I think it's affected everybody in the nation. Of course, it's going to affect our family. But I'm so grateful that it didn't affect our family as much as some other family who lost their loved ones have have illness, being hospitalized, and that. But I think one very direct impact I can see is on my mental health of my teenagers, because of the move too, because of isolation. I cannot imagine those parents that have little ones. How can you do a Zoom teaching at home, and how can you self-teach, and how can you keep your job while you have to teach little kids at home, right? Because I'm a grandmother babysitting my daughter. My daughter is going to school part-time. It's very challenging, but I'm there even helping 3 months, right? 3 weeks or whatever the time. And I would say that, like, my youngest child goes, Mom, I only know 10% of my graduating class, maybe only 5%. So can you imagine the teenagers? This is the most social age. I think that's why I think the teenager suicide and mental health issues, it is so high during COVID. Is already, but COVID is really affecting their mental health. And I will say also that that I think I have one of my 5 kids have COVID, but we have been like a really, really careful. Like I haven't gone to the gym for more than 2 years. I just didn't want to deal with it. And part of me is like, oh gosh, then I have a reason not to go to the gym, right?
Yeah,
But
excuse
yeah,
me.
I know, but I really didn't want to go to indoors. We try to eat outdoors. So I wear masks when I still can. Like, we strongly encourage everybody on the convention wear masks, because we know that the COVID is still around the corner. I myself vaccinated, get my second booster several days ago, and not second booster. Second booster, the 4th dose, the second booster several
Right,
days ago,
right.
and I wear mask, and I just practice, a good, just reasonable and common sense, hygiene, like washing hands.
Yeah.
And like today I was invited to a pastor's house, and I just said, okay, I'm sorry, I'm not going to hug you because of the COVID, things like that. So I yeah I know that it's going to be with us, but I know that it's still very difficult for a lot of people.
Right, right. It is. We need to be careful with so many people. So your estimate about close to 500 people going to be there.
Yes, close by 500 people are going.
Awesome.
No, yes, 500 people register already, so it's going to be at least probably 550, between
Wow.
550 and 600. Yeah, we
And
still have a week. A
amazing.
lot of Chinese like to do things last minute. I'm still like getting calls like today, like, okay, how do you register and all that? So
Yeah,
yeah, I think.
yeah, yeah.
But we're taking like a very, very careful approach. We have a first responders team with a
Mm,
physician,
mm,
professionals, and also the hotel
mm,
management. Someone who has worked, Mr. Sun, uh,
yeah.
has worked in the hotel industry for
Mm,
25 years. So he said, I'm just going to put my little orange jacket on, has a first responders team for
yeah,
fire,
yeah,
and then
yeah.
also you think about the gun violence too. Sometimes I go to these places, oh my gosh,
Right.
you just like, that's my nursing hat. We have to be
Mhm.
prepared for the emergencies, right?
Right.
So but and then we require vaccination, and we also have 1,000 testing kit donated. So we're going to
Mm,
provide free testing. We have thermometers. We have free masks. You got a nurse on the team. We're going to have all those toys there
yeah,
ready,
yeah. That's
protections.
awesome. That's awesome. Yeah, we have one comment from someone from Facebook. We don't know who, but he or she said, "Glad to see you, Lily Chen and Ching Juhl." Can you see the people's writing on
You know
the
what?
no?
I could try.
No, it's right
Oh,
on the right hand side. Right
yeah,
hand side of your screen.
yeah.
We have
Okay.
TED Talks.
Great to
Um,
see you. Yeah, Facebook user. Yeah, I saw
yeah.
that. Okay, great. Yeah, hi, whoever you are. If you put your name, I will address you by name. And thank you so much for listening in.
Oh, Renee. Yeah.
Yeah,
So
that's
we have
awesome.
Shock FinTech, who is my friend Mark from New Jersey.
Hi, Mark. How's your
Yeah.
thing?
Yeah.
Okay.
And then let's see. So I was thinking, we all together we're gonna at the conference there will be this like a screening 3 movies, right?
Yes. So your movie, Yang Gang, is going to be on Thursday night, starting at 9:30, and on Friday we are going to have a Silent War. That is the movie that we are. That is made by director Chang Cheng. It's about Asian American stories. I can't wait.
Can
We
we?
do have a 2-minute
Yeah,
trailer.
yeah. Can we play the trailer?
Oh yes,
No.
please play the trailer.
And the
Thank
third
you.
third one is what?
The third one is Deep South Far East. I think that is by that is I'm sorry, I should know the name, but let me see here. So we have a third movie. So Silent Wars at 7:00 and followed by the Samsa workshop, and then Deep South Far East, I think. That is going to be starting about 9:00, 8:45, 9:00. So that is another award-winning producer.
Cool. All right, so we're gonna watch this 2 minute
Thank you.
46-second.
他才40岁啊，那时候是，你怎么都想不到。
It felt like someone had just severed my arm, kind of like that feeling of loss. We didn't really have suspicions of his mental illness until I became sick.
他会突然冲到街上去，不管那个街上面的车是怎么开，他完全已经没有理智了。
Much after he had passed, right? My grandpa would tell them like, "Oh, you know, he's old, he's well, like he's doing okay. He's living with his wife and daughter in the States." That just shows how deep-rooted the stigma, you know, in our culture, in our community really is.
Things got to the point where I couldn't take it anymore, and I tried to take my own life. And they asked me why, like, how could I feel this way when I have everything that they've given me, when I have a house to live in, when I have clothes to put on, when I have food to eat.
我的兄弟，如果妈妈以前有什么对不起、做对你不好的地方，请你原谅妈妈。只要你肯跟我说话，肯告诉我为什么，我会去改。
After I heard them say that they loved me, I started crying. I was just feeling like very loved and seen for the first time in like a long time.
美国小孩他不理解我们当父母做父母的对他那种爱是藏在心里头的。
那从来都是一个禁忌的话题，就大家都避而不谈的嘛。
I try to bring up mental health with my friends whenever I can. I try to tell them, you know, you're not alone. This is very common, you know.
就是我们这样讲出来，也是帮助别的个家庭，帮助别的患者，然后大家共同来面对这个问题。
I just want to share my story because I don't want anyone else to feel like they have to suffer in silence.
That was very powerful.
Very powerful. Yeah, Director Chang has worked really hard, like no sleep in entire summer and past months. Like I said,
How long is the film?
right now, he is hoping to develop about like a 20 minutes to 30 minutes film, but eventually, but he has filmed so much more people, so many more people who wanted to participate, but you just, you know, you're a filmmaker, you know how difficult it is, right? And without without enough funding. So eventually by next year, he's hoping to do about an hour and a half and 2 hours, the full documentary film.
We call feature. Yeah, feature documentary.
Documentary feature. Okay.
All feature documentary, both ways.
A feature documentary.
Yeah.
Okay.
Yeah.
Thank you. Mm-hmm.
Yeah, sure. Right now is like about 20 minutes or 10 minutes.
No, at the convention, it's going to be preview. It's going to be about 20 to 30 minutes, probably 25 to 30 minutes. Yeah.
Okay.
Yeah.
Okay.
I hope that I can see you there.
Yeah, I definitely will be there. Yeah. No, this is a very
yeah. And then we're following by a panel discussion by Director Chang and also Dr. Justin Chen and Sandy Chen, who is one of the characters, Elaine Peng, and Vincent Tu, who is a AAPI, sharing his stories as a South Asian about his experience as an immigrant AAPI growing up in America. Very, very powerful. I can't wait.
Nick is here. Hi, Nick. Nick Riviera says, hard-hitting trailer. I'm interested in seeing it. So when you see my movie, Nick is in it a lot, and he's a kinetic young gun. we're partners at canvassing.
Oh yeah, yeah, yeah,
Yeah,
yeah.
uh,
Yeah, that's
in my
awesome.
trailer,
Go Yang Gang.
Go Young. In my trailer, he's also there. I I have to say that uh, depression, talking depression, is something I care about it because on Clubhouse, I'm on Clubhouse a lot. I told you, I actually on Mondays, maybe twice a month, I host a room we call a club. It's called Talking Depression. I
Mhm.
sit there. I just say, "How are you feeling now?" And people just come in and just talk. We just talk to each other. Some I met people from different countries, from Middle Eastern, from China, from middle of the United States, and different part. Well, what made me to hold this? Because I I suffer from depression, and I am still, and people think like I'm so, bubbly and cherry and, like funny, but yeah. So it's a very important thing. And I'm very glad people are talking about now, right? It's not like it used to be like people really avoid to talk about. They don't want to say I'm depressed. If you have depression, you're weird, you're not normal, right? But that's true. We are not normal. No one is normal, right?
But I think we are very all very unique, and we are very unique individuals make up of the unique biological, psychological, emotional, and physical well-beings. So I think that um, we need to be aware of our differences, in every way.
Right.
So definitely, I think that we do need to normalize mental health. We do need to normalize. It's just like we normalize hypertension and diabetes, right? This
Right.
is something that you didn't choose to have it.
Yeah.
So let's normalize. What I meant is that consider it is like a physical illness, right? So it's not something that anything wrong with you or anything like a crazy about you or anything so quote unquote abnormal about you, right? So we just we just
It's
have
just,
some
it's,
challenges. Different people have different challenges of
it's
physical,
just the
emotional, mental.
brain. The brain is part of the body, so your
Right,
body
right.
part
Yep,
is malfunction.
yep.
Is 短路了嘛，短路了，
对对对，短路
短路
就
means
说 yeah, like we are all we got broken legs, we got broken fingers, we
yeah,
got cold, we got COVID. It's just the
yeah,
same thing.
yeah.
Unlucky.
I want to show. Do you see it right now? I wait. Sorry. I wanted to show, a trailer. My Young Gun Diary trailer. It's only a minute 44.
Awesome, awesome. Yeah,
So
I saw that. Yeah,
this
it
is
was so powerful.
thank you. This is my Young Gun Diary website.
Yeah.
Okay, so you just type in my Young Gun Diary. Now, finally, we are, people can, for a long time, when you type in my Young Gun Diary, people cannot see our website. So at the front page, it's called, it talks about a little bit how long it is. And then over here, if people want to watch it, they can click on it and they will
Okay.
lead this thing to a Vimeo on demand. Okay,
Mhm.
and then you have to bleed $4.99 to watch the whole thing. Now this is the trailer, and then in this website, Nell Nevius helped to develop this, and I'm the one adding more stuff in. This is the news, right? News. I had the news of my Yangon screen at United Chinese American Convention. So I will put whatever news I have in there. And then in here we have trailer, we have reviews, press. You can read the press and credits. Credits are very impressive. This film is not my film only. About more than 120 people involved in this film, whether they are taught, being interviewed or they're helped out or they
Wow.
do different angles. So my credits goes mile long. Yeah.
Yeah.
Uh, yeah. All
That
this.
is so important. Nothing is done alone. I think it's any kind of impactful project, beautiful jobs,
Mhm.
and events are always a collective wisdom and hardworking
Yeah.
of many. But obviously, you as the director probably spend the most of the time, of course. Yeah.
And
All of
and the film has very powerful music soundtrack.
I heard that your violin was so beautiful.
I played a little bit, but we have like a beat
Mhm.
R&B. We have a string trio by my ensemble. We have
Mhm.
a Canadian indigenous
Yeah.
drummer. They're very short clips, okay? And we have music from Portugal musicians.
Oh, okay.
All kind of. We have Japanese jazz
Mhm.
trumpet player, and we
Right.
have Yangan who donate their music. At California Yangan, also Florida Yangan, their music, and we have Chinese music. We have
Mhm.
just like a variety thing. My
Mhm.
brother's music was used. So let's watch the trailer. Let's see.
Yeah, absolutely.
Okay.
Yeah, Nick, I saw your comment. I'm so sorry, and thank you for sharing that.
What did Nick say?
She typed on the comment. Yeah, she just said the mental health strongly resonates with me. I suffer from depression too. Yeah, 1/4 of the Americans have mental illness.
Told you why he's different and why that's good and why it goes to the question of electability.
I am that candidate. I can build a much broader coalition to beat Donald Trump.
I grew up in Shanghai, China, and I studied violin and viola. I left home at 17, joined Chinese Army Orchestra. In those days, that was one of the best career moves for many musicians.
Show me the money! Show me the money!
UBI is freedom.
Democracy looks like! Show me what democracy looks like! From this country, not left, not right, but forward!
That's Israel. He's keep walking to the house.
You get off my fucking property. You have no right being on my fucking property. You Chinese people, go back to fucking China.
You do have to have certain like preparations in your mind.
We want Yang! We want Yang!
I wrote it. Andrew Yang.
This is not the end. You brought me back from being too far gone.
We're doing great. Anything else we need to talk about before we do rapid fire?
No. It was just really nice to talking with you and about. I don't usually, honestly, I usually don't like to be interviewed, but yeah, I know it's weird to talk about yourself, but anyway, but thank you for the opportunity.
You're so good. You can have a podcast yourself.
No thanks. I know it's a lot of work.
It's so dynamic. Yeah. So you guys, Sharkfin, Nick, thank you so much for being with us.
Yeah, thank you so much.
And do you have any questions for Lily? If not, we're gonna do a they know. Yeah. Sharkfin always comes to my program. Yeah. Anyway, okay, let's start. All right. What's your favorite color?
Pink.
What's your favorite Cantonese food?
Porridge.
Oh, I love porridge. 皮蛋瘦肉粥.
Yeah, 或是艇仔粥啊，艇仔粥，就是有花生啊，有鱿鱼啊，有什么的一些放在一起，什么 vegetable
Yeah,
I love porridge because it's so good. I love soup and porridge. So absolutely, yeah.
Can you translate what's 艇仔粥 in English?
艇仔粥啊哈，艇仔粥就是说有这个鱿鱼啊，有这个花生啊，有鱼丸呐，还有一些。 要艇仔就艇仔粥，係啊係啊。But 但是呢，就是說，我覺得最主要那個做粥，
You
它的那個
have to tell them in English, dear.
Oh, I'm so sorry. Okay, it is. Well, maybe you should learn some Chinese. I'm just kidding. So it's like a square fish and fish ball and peanuts but I would say the porridge or the zhou in Chinese. The most important is to have the base, cook it really well.
Yeah.
So when you go to San Francisco, Chinatown, that's
yeah.
something that I always love soup and porridge. Yeah.
Do you cook every day for your family?
Not recently, but today I'm making some soup because I said, oh gosh, I'm going to have this interview and then I haven't feed my family for days. And so I put some like ribs on the stove and put some soup. And then I said, I'm just going to use the rib and dip with soy sauce and make a vegetable. And that will be our dinner.
Oh, that's awesome. That's awesome.
Because we have meetings every night. So I think my family's really tired of us. Mom, can we cook some vegetables? I didn't even dare to text him back. So my husband said, oh, don't worry, I got him already.
So I know you're very, very dynamic and very capable woman. And when you on a, what do you call it? When you wanted to, how do I say, accept someone working for you, right? What are the 3 basic qualities do you look for?
Yeah. So I think that if anybody who has been like in hiring or working, is really hard. But I think that absolutely the person has to have passion. I think that the passion really brings the best out of people. The second thing I would think the communication skills. I think it's really important how you get along with people. How do you resolve the conflict? How do you move forward with the division? And I would think the third one, I think just have a little fun. You know what I mean? So just like I love being around people who are fun loving and just life is about really bring joy and bring happiness out of everybody, right? So we wanted to. I always like. I always like want to bring that part. I don't know if that's what my boss wanted to hear or what other people want to hear, but this just comes from my mind.
I want someone who's fun.
You are just like have passion and get along and just have fun. So
I want fun
this
people.
kind of person that this kind of person.
That's wonderful.
Yeah, somebody you want to be be around, and I do think that communication skills is more important than technical skills.
Yeah, that's wonderful. That's wonderful. If you have an opportunity to have dinner with 3 persons, not at the same time, dead or alive, who would you like to take them for dinner?
Who would I like to? Oh gosh, I will love
me.
I have it. Yes, Juhl. Of course, you're one of 3. That's without saying.
Just kidding.
Right. So, what I would really love is that I would like to take my mom and dad, because I never felt like growing up I got to know them so much. And now my dad is 90 in China, and then also my mom's in the late 80s. I wanted to hear more about what their life was about. And then also I would love to I have such a happy memory in China growing up in Guangzhou, in Guangdong Canton. And I share with you that I live in Kongjing Dayuan, in Huanghuagang, Dongsankui. So I have such a happy memory, and that I'm still keep friends with my elementary school friends, my nursing school friends, and my junior high school friends, right? So when I went back, it's always busy, tons of kids, and all that. I wanted to like just have one person to take to be with me, because I do go out with my husband and my children. So I'm thinking about the people who like I won't go out in my life circle, right? So these are my mom and dad and my childhood best friends, because I'm all about connections, my friendship, because I'm just a very
you're a people person.
Yeah, I like to. And also I'm very loyal as well. I think that the relationship is really important for me. The third person, other than Juhl, I would love to go out with someone, because I'm a Christian, I would love to go out with someone who I don't know who, just like it can be my like I have a very close group of friends, of Christian friends in Naperville, but after I move, I have to reestablish everything, right? So I think that very good Christian friends and like a sister in Christ, and we can really encourage each other. We don't get to do that very often, either. I think that's really important for me, and because that's where I draw actually the source of my energy and also my joy coming from. So I wanted to be with this person, but I have multiple. I don't want to mention one, you know what I mean? So then I would love to have more like a sisterhood and just kind of filled with the joy from God.
Yeah, yeah. Wonderful, wonderful. We have a question from Shark Fin for you.
Oh,
Lily,
okay.
a New York City doctor, took her own life in 2020 due to COVID stress related depression. I believe she's from North Carolina. What specific program exists to aid healthcare workers with mental health?
Oh, yeah. Thank you so much for sharing. That is so heartbroken to hear. Anytime the life loss, it is just so heartbroken to hear. As I mentioned before, I don't know the circumstance, right? There's different things that can be done on the individual level, on the organization level, on the social level, family level, or also on the policy level. So as much as I remember my colleague and my clinical scholar, Dr. Justin Chen, who is a MGH, a psychiatrist, and also the faculty member at Harvard Medical School. He said that actually he was interviewed. He said that if you ask me these questions about 5 or 6 years ago, I would say stigma about mental health knowledge. But right now, I'm going to say the policy change that we needed to just have organization policies and structure in place to better support them. For example, very concrete. Do you have a counselor, right, for the staff? And do you have a gym nearby free of charge for all the employees? Do we have like something like I read North Carolina Nurses Association published a survey about the nurses pandemic. And I remember that's one of my op-eds I wrote. It said, please no more pizza parties. Please no more meditations. We're dying here. Have some, what that means is that don't do just lip service, what the superficial things, doing some concrete, systematic change, how to support them. That will be it. And then also on the policy side is the pay, right? With so overwork and underpay, how do you increase the staffing? What is a safe ratio for doctors and nurses to patients? You can't expect the doctors work 24. Again, I have one of my children is a physician, is a resident. You can't expect the doctors work 24 hours, 36 hours, and then make a sound decision. Nobody could, right? So what kind of a ratio should be there? How can we support the doctors and nurses so that they can have a break and have a balanced life? Not in that environment. Nobody can make that decision. Nobody can make a sound decision, and including the decision about how to take care of themselves and how to live, basically, right? So these are just some of the things that I can think about, but I think that more importantly, check on each other. Care for each other. How are you doing? Just like what you do. Set up a room. Just have people come talk. How are you? How are you doing? Don't ever estimate the power of community. And I remember reading a story about a young man who died by suicide at Golden Gate Bridge. He left a note in his apartment. He said, I'm going to walk to the Golden Gate Bridge about 25 minutes. If during this 25 minutes, if nobody say anything to ask me how I'm doing, I'm going to end my life. And nobody did. And then he ended his life.
Oh, no.
So of all the big talks and things that we should advocate and should do, remember each of us has a role, right? So convey that love, convey the care to each other. And it is all about people. This is about relationship, about people. So that a smile goes a long way. How you're doing goes a long way. I also remember somebody said, again, I can't remember who, people would not remember what you said. Was going to always remember how you made them feel, right? Be kind to each other, be accepting, and also be generous, be graceful, and just be kind.
So true. So true. Yeah. Thank you for asking the question, Xiaofeng.
Yeah, thank you for that question.
Thank you for your elaborate answer. Thank you. Well, let's see. How about 3 more rapid fire and we end the session?
Okay.
Any places you want to visit in the world is now United States and China.
Yeah, I know. I always say Paris. I think it's so pitiful. Like one of my children have visited like Europe for like, I don't know, 3 or 4 times. I have never gone out of China or United States.
No.
So I'm not traveling. I'm a little handicapped. I don't know how to book the hotels or travel, or I will get my family and I were at the beach, just like in North Carolina, right? I could got lost just going to the hotel, drive to the beach about 10 minutes, going there and coming back and get lost. So it's like I'm so hopelessly like disoriented. So I will always say go to Paris. I would love to see the, it's such a romantic city, and also the paintings, the Monet Garden, the coffee shops and the lifestyle. I know that the lifestyle is a lot more less. It is not as a rapid. So I kind of like that. That's part of the reason I like North Carolina too. It's like it's calmer. It's not as fast, and I like that. That's what I always say. I know that to a lot of people it's so boring, but
yeah, well, that's great. Paris is great. Yeah, I've been there like at least twice. Yeah.
Oh my gosh, I know. I'm so
it's beautiful.
Yeah.
It's beautiful. Any books you recommend lately? You like?
Yeah. I always think that if I have time, I love to read more books. But I have a reason, like at Christmas, I read like 3 books, but I can't remember all the names. But I would say a great book. I would say several books I read recently, and a couple of books that I really love it. So one is like old books. It's called When the Spirit Catches You Fall Down. It's about Hmong family, about the culture, about it was just so beautifully written. And then another book is Tell My Name and by Chantel Miller. Know My Name by Chantel Miller, and tells about her courageous journey to fight the sexual attacker, and also her just painful journey, right? To deal with that. Just incredible, beautiful. Both of them New York Times bestsellers. I don't know what else. And I think I read another book. Is called.
Did you read Andrew Yan's book, The War on?
I have it. I have it.
Do you have it? Do you have it? I bring one for you.
Yeah, I do have it. I haven't read it yet. So again, I usually I just grab a couple books in my purse. I said, I'm going to read it when I'm, at the beach, but I didn't. So I have to say, I certainly need more time to read more things. And I've been reading a lot of leadership books because as a part of the clinical scholar training, it's actually leadership development program. So I love those books, like adaptive leadership and things like that. It's all about communication, how to be effective communicator and how to be a effective, I hate to say the leaders, but I think these are very transferable skills into all areas of your life, not just in your academia or your community work.
Right. I recommend when you get a chance. I know we're all busy. I don't read very much either.
Okay.
Listen to YouTube. I talk to people on Clubhouse. But Andrew Yan's forward, the book, is worth reading too. It's very good. It's the one came out last year. And then The War on Normal People is that really sold me, because I read that, I became a young guy. So.
Oh, okay, that's great. You know what? I just developed a app, Blinkist, right? So I subscribed that, but I forgot after the free period. I forgot. But it's just give you the summary of all the great books. That's awesome. I don't have to read, but I can be like, I can be informed so that I can, like appear to be like informed or smart. I don't have time. But I need to maybe subscribe.
No, I think many of us probably don't read as much as before because we have different social media. I spend time to, look doing Instagram. I do a lot of video, and and I don't remember I hold a book to read every day. I probably will read on
I
airplane
will
or
love it.
something.
I will
Maybe on
really love
airplane.
it.
Yeah.
I will really love it.
Yeah. So what else question I had? Oh yeah, any favorite film? What is
My
your
favorite
all-time?
film?
Yeah, all-time.
Oh my gosh, I have no idea. I don't
Oh.
remember all the names. I would say I always like say if a family that have some time, hey fam, what kind of movie you want to watch? The only thing that comes from my mind is how about Sound of Music? Or I know it's like so fun.
That's
Like
one.
the other
That's
day,
a good one.
my husband is watching something because I don't really have time to watch TV or
Yeah.
movie, right?
Yeah.
So anytime it's like Witness, he's watching Witness. What Witness? I said, oh, you watched so many times. I find myself can't remember any names, so I just sit down and watch it. It's more about watching the films together with your family, with my daughter, with my husband, and just like
Yeah.
watching the Witness. Oh yeah, that's a great movie. So
Yeah.
when I'm watching it, so I can't remember. Like what's a good movie to watch, but any kind of one thing I can tell you is that I couldn't stand any horror movie or any violent movie. I always have to, like even Witness, they start shooting like each other. I have to close my eyes. I said,
Yeah.
is it over? I couldn't do that.
No, I couldn't either. I think that Nick made a comment. I think it's to you. Your kindness, energy, and passion for your mission shine brightly.
Oh, you're so sweet, Nick.
Yeah, he's so sweet.
You're so sweet.
Anyway, so yeah, I think we are going to end. One last question I always ask my guests: coffee or tea?
What?
Coffee?
Coffee or tea? Oh, coffee.
Coffee? Me too.
I should drink more tea, but coffee.
Me too. I love coffee.
Yeah.
I developed a fancy taste. I drink Turkish coffee now.
Ooh, okay.
I'll treat you when you come to New York City.
Yeah.
Yeah.
Great.
So it's been a great fun and very informative, very educational to talk with you, Lily, and I can't wait to see you. I'll see you next week.
Oh, thank you. Yes, I'm so excited to see you. Thank you so much for inviting me, and thank you for all the great works, and thank you for your wonderful audience, and Nick, and I'm so sorry,
Mark.
Sharkfin,
Yeah.
Tang, and all of you for being here, all the audience for being here, and it was so fun talking with you, and I really enjoy it. Thank you so much for inviting me.
Thank you. So we are going to, I guess you're going to be pretty busy working now until next Thursday and continue during the
until next Sunday. But it's going to be really fun too, seeing all the friends, and I think I look forward to it. I just hope that I don't get COVID. So
yeah, me too. Well, thank you so much, and thank you, Nick, and thank you, Sharkfin, Mark, and thank you, Ted earlier was with us, and thank you people who did not make a comment. They are here with us anyway, and we really appreciate you. And this video can be replayed on on 3 devices, on YouTube, on Twitter, and on Facebook. Yeah. All right, great, and be well, be safe, and be kind to each other. Yeah?
Bye.
Thank
you so much. Have a wonderful night, everybody. Thank you so much.
Thank
you. Bye.
Bye.